Hello, welcome to HealthFiles. I am Neetu Grover. Have you heard of Alzheimer's disease? It is the same disease that happened to Amitabh Bachchan in the movie Black. A disease where you slowly tend to forget your name, your address, your loved ones, and sometimes your basic behavioral skills. As per report, in India, there are over 4 million cases of Alzheimer's disease. But today, we will not talk to the patients of Alzheimer's disease, rather we will talk to the family members of these patients.
Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
What does it mean to live with an Alzheimer's patient? What does it mean to live with a loved one who does not recognize you sometimes or behave erratic? We will talk to one such person, unfortunately, who have faced similar situations in his life. We will also have a view from an expert who will guide us about the to-do list of family members of Alzheimer's patient. Our first guest is Mr. Indro. Indro lives in Bangalore with his wife and young daughter and works for a technology company. His father was diagnosed with Alzheimer's 4 years ago and sadly passed away in 2019 from complications caused by dementia. We welcome you, Mr. Indro, to this very special episode of Health Files. Our other guest today on the panel is Ms. Vidya Shenoy, Secretary General of Alzheimer's Related Disorders Society of India. She is also a member of Maharashtra State Mental Health Authority, a specialist in dementia care. She practices integrative medicine with customized packages of these holistic therapies for seniors, those affected by Alzheimer's and dementia, and children with special needs. We welcome you, Ms. Vidya Shenoy, to this very special episode of our show.
Thank you, and very privileged.
Mr. Indru, my first question to you is, tell us a bit about how and when you first realized that your father had Alzheimer's disease.
To be honest, we did not have the faintest idea that my father has Alzheimer's disease, or uh, or like we did not have any knowledge about dementia and how it can affect the elderly. So, um, and we were totally clueless. As in, the little that we have heard about Alzheimer's was that it's a disease about forgetfulness, and it's a very lame way of putting it. That is something that I know today. So the reason we went to see a doctor in the first place was that there were significant behavioral changes in my father. He was he had uh, very violent outbursts. He also did physically attack family members, and and in general, like there were a lot of things that we were just not sure that why is he behaving the way he was. So and that's the reason we went to see a doctor, and we really did not know which doctor to see. So we started with a psychologist. So pretty soon in the medical chain, we were sent to a neuropsychiatrist. So that's the stream neuropsychiatry. That's the stream that takes care of dementia, and it was diagnosed that it is dementia for sure. Now, what the doctors further prescribed is to understand what kind of dementia it is. It is good for us to get a PET scan of the brain. So that's what we did, and that scan confirmed that it's Alzheimer's dementia, and this is how it was diagnosed.
Okay. Ma'am, you have worked extensively with Alzheimer's patients. So, what are the common signs do you notice, and how does these signs vary from someone with Alzheimer's and someone with other forms of dementia?
Firstly, I have to tell you that Alzheimer's or dementia, any form of dementia, is not age related anymore. as it used to be in the past. The difference between aging and memory loss and dementia is that the person is totally different from what he or she was earlier. So there's a personality change in the individual, or as I call the family living with dementia. And that's a time that is alarming that we need to do something about it. There are three stages in which you can actually find out. The first stage is normally overlooked as old age, saying somebody over 60 has to lose memory, which is not the case always. Then there's a a middle stage where you realize that the person is not only forgetting things, but they are failing to recognize and recall. And the third is when it's far advanced because intervention or diagnosis hasn't been done earlier, that they go into a very, very different phase, which is difficult for not for them because they are not aware, but it's difficult for the caregiver or the family, other family members involved. So, it's a loss of memory, it's a loss of awareness of knowing where they are, the time of the day. They could be, just wandering off. They, as Indro said, that, people get violent later on. They could take things for granted. Okay. There's always also a thing that, people with memory loss, with Alzheimer's, are not the same what they were before. And there are mood swings. So you might find, a person being very, very normal with, when we go for assessment and, when I go for, in finding out what kind of therapy can be done, they look so normal that you wonder who's got dementia. You see?
True, ma'am.
They're very different. They have their mood swings. And, so the earlier you diagnose, intervene, start those therapies, it's going to be a difficult challenge.
Mr. Indru, did you notice any of these signs in particular, or are there other signs that you noticed?
Yes, absolutely. And to be honest, it's all in hindsight today. When those signs or symptoms were happening, we ignored it. We thought it's, as Vidya ma'am just said, we just thought it's with it. We chose to ignore them. But yes, there are many symptoms, many things that you can notice early on. So let's say my father, uh, the year he was diagnosed was, I think, 2013, 16. Okay. And if I was to look back, initial symptoms happened at least 10 years back. Okay. And all this while we were so ignorant, we did not know, and we
That's what, Indru, that's what my next question is, that, in the hindsight, does it feel that you could have detected the signs earlier had you been knowing about the disease?
yeah, absolutely. And that's the reason. So one of the reasons I chose to do this interview is so that more people are aware. I mean, people like me are made aware of this disease very early on. And there's another thing, as in our society does not speak about mental illness, things like this. As in, if something like this happens in their family, people don't want to speak about it. But I think
True.
to be broken, and that's why I have been vocal about this in my personal capacity in social media.
That's
And yes,
really generous of you that ways, Indru, because, it's a personal loss, an irreparable one, but still you are being vocal about it.
let me quickly share some of the symptoms that I had noticed and I listed, just to add
Please.
to that. So one of the symptoms I would say is paranoia. So patients are is always in a threat of, like, people around them are going to hurt them or steal from them or disrespect them. So that's a paranoia that goes into their mind. So if you look out, if you see that there is paranoia in your loved ones, so be aware that this might not be just old age. Okay, so that's a good time to see a doctor. Plus, uh, if they turn disorganized, things that they were able to do earlier by themselves, they are unable to do them They're unable to put their thoughts in proper language. So these kind of things, uh, they're unable to plan out anything. Like it's an age where, uh, let's say, for my example, I would say, like children's marriage. And my father, I can now think back that he was unable to plan anything at that time. So my uncles and everybody came into the. But again, like the idea is inability to plan things, complex things, these kind of things. And there were deterioration in personal hygiene is another factor, I would say. Like not keeping yourself very tidy.
I'd just like
Yes,
to
ma'am,
add
please.
something. See, dementia, the signs that we're seeing is much later than the onset of dementia. Okay. So what happens is it starts about 10 to 12 years earlier in middle age, and we think it's just a forgetfulness or whatever. So when you start seeing the actual signs, that's the time when the chronic the chronic symptoms have come up. Now these symptoms are seen because it's far too much for us to handle. Okay. And the other question you said was, what are the types of dementia? You have vascular dementia that's related to the heart disease. That's why we say what is good for the heart is good for the brain. Okay. You have Lewy body, you have mixed dementias, because it's a very fine line between dementias. So a lot of times they have overlaps, or people with Parkinson's, So there are various types, and the best thing is a neurologist who would be able to diagnose with various MRIs and scans, would be able to pinpoint what form of dementia it is.
True. Vidya ma'am, what are the various initiatives being taken up at government or your association to build awareness among the citizens, or to be put it differently, are we doing enough to create an awareness in this case?
See, when it comes to health and quality of life, I think nothing is enough. There's always space for more. But as an organization, we are an organization that's pan India, that was registered in 1992, and we have 20 chapters all over. We are also the first to be affiliated with the Alzheimer's Disease International, and being the first Afro nation, to be a part of Afro-Asian nation, to be a part of the ADI. Now, what we are doing at the level at the ARDSI in India, our main thing is advocacy, awareness, making awareness to the point that we increase and spread awareness to the point that there is no social stigma. As Indro said, that nobody wants to talk about mental health because either they are possessed or they are mad, and both of them don't fit the parameters of the metrics of dementia. Okay, so we are trying to remove that by having a lot of awareness talks, advocacy, health camps, training centers, training for family members and carers, and campaigns are going around. Like, for example, September is the month of Alzheimer's, so we ran a special campaign during this pandemic. So awareness is the main thing, and our mission is to have a dementia-friendly society. Which is, if that's we have, then the onus will be much lesser.
Vidya ma'am, you have handled a lot of such patients. So what is your advice? What is the best way to handle such patients? And how should the patient's family should manage this emotional situations?
I think the main thing is it depends on which part of the brain lobe has been affected. Okay, so depending on that, the functions change and get challenged. So their thinking, their daily activities, of daily living, activities of daily living are affected. Most importantly, there is like the network, the brain network is not functioning because of the synapses. So there is a disorientation and lack of communication skills. So it becomes more difficult. So I think handling such persons living with dementia, I don't like to call them patients because they are family after all. So they are the ones we have to actually use non-verbal language. Some of them, due to age, cannot hear properly. You put a hearing aid, they might pull it off and throw it out. Okay?
Mm.
They might get violent. So what do? I think the best form of handling persons living with dementia is non-verbal communication. Like you hold a child's hand while walking across the street, or you are cuddling a child who's crying, saying, "Don't cry." I think that gesture will be more effective than giving a big lecture saying, "Don't do this, don't do that, or you should have done this." So I think non-verbal communication reaches out much faster. Physical touch, they get the message. A look in the eyes, that is enough. So I think non-verbal communication is a hallmark of care management for dementia.
And will make the difference in handling such situations. Indru, it is often said that heredity sometimes plays a part in Alzheimer's. I'm sorry, but I really wish to ask this question for our viewers. So, do you feel scared about yourself, or is there any precaution that you have taken or change you have brought in lifestyle after this experience?
Oh yes, yeah, I was afraid. As a matter of fact, it was one of the first questions that I asked the doctor after my father was diagnosed with Alzheimer's. So the answer I got back was hereditary does make some impact, but it's really a 50-50 chance. As in, even if somebody does not have Alzheimer's in their family, even they can get that. So Alzheimer's is a 50-50 chance, really. Plus, I did a lot of research about this disease while my father was suffering from this,
I can
and I
understand.
found that accidents, impacts to the brain. If the patient had a fall at some point in time in their life, that can also lead to Alzheimer's disease. So I'm trying not to fall down and impact my brain. But on a serious note, I was told that you have to be into creative things, as in try to write stuff, paint, and anything creative which uses the brain cells, play
That's
chess.
what I was just going to ask to Vidya ma'am also. Vidya ma'am, since you have treated patients with integrative medicines and have done workshops around yoga, therapies, etc. So how does these alternative forms of medicines help the patients, or for that matter, how does it help from prevention?
See, basically, the factors that lead to dementia are of two categories. One is modifiable, and the other is non-modifiable. In modifiable, family history and age, you can't change. So we pretend sometimes we are younger than we are. So age and family history you can't change, but there are modifiable factors which we can start young. Okay, that means regular exercise, social engagement. Try and meet as many possible. Try to develop the personality of being an extrovert. Healthy diet. I think diet is very important. Mental stimulation. Mental stimulation like Sudoku, crosswords, anything that will make you think otherwise. Or if you're a right-handed writer, you write with the left hand. You learn a new language. You learn a new musical instrument. Learn to paint. If you're an artist by choice, then learn to do charcoal drawing, something different. Then another important thing which scientific research has shown is that you need enough sleep. You have to have sleep, because if you don't have enough sleep that your body needs, you're prone to be very highly stressed. Okay, or some
Very
matters that
true,
might
ma'am.
concern you
Very
too much,
true.
you might get depressed also, and then with depression you tend to isolate, and when you have an isolation, then again it's catalyzing the process of dementia. Vascular health is very important. I think you need to look after your health, not put everything in the mouth that you see and you want to eat. Sugar, diabetes, hypertension, I think those are very, very important. And moment you have your physical health in control, I think you're helping your brain to function better and be more alarmed. So normally what I say is, the earlier you start, the better it is. Um, try these modifiable factors. And when you said, how does it help? I'll give you a very simple example. Um, when you're feeling low, the first thing you want to do is listen to an old sad song. Then you realize it's making you go into more depression. So what do? You pick up peppy music or song or something that you like. So I think music is very, very effective. Yoga, I'm passionate about it. And what I believe is yoga not only helps the person who has dementia, but it helps the carer and families to be able to meet the challenge of handling them. Now, of course, if they're in advanced stage or very late where they can't understand communication, then to make them explain to do breathing is difficult. So least you do is make them hyperactive, with some simple forms of exercise which they can follow. So I think exercise, music, dance, for example, you play music, the first thing anyone will do with dementia or without is either going to tap their toes or their fingers on a table. It's a very
Absolutely, ma'am. As they say that music can hear the beating heart and the soul, and it gives wings to mind and flies to imagination. So, as expressed by both of you, that early we start, the better it is. So, thank you so very much, Mr. Indro and Mrs. Vidya Shanoy, for giving us the insight, for guiding us so well, and for sharing your valuable experiences for our viewers. Thank you so very much.
Many risk factors are involved in developing dementia or Alzheimer's, including medical conditions, lifestyle choices, genetics, and old age. If you have a high risk for developing dementia or Alzheimer's, see a doctor or seek an advice from an expert about how you can prevent it or any lifestyle changes that may help. So goodbye till we meet in our next episode. Stay healthy, live life. Thank you.